Good morning, everyone. So, the topic of today's lecture is matricing in operative dentistry. We'll be covering the presentation under the following contents. So, moving on with the introduction. So, what exactly is matricing? Matricing is basically a procedure whereby a temporary wall is created opposite to the axial walls surrounding the areas of the tooth structure that were lost during the process of cavity preparation. So what are the objectives of matricing? So matrices are basically used to confine the restorative material and to establish optimal contacts and contours. So let's first discuss the classification of matrices. So based on the mode of retention, the matrices can be classified as with retainer, without retainer. With retainer, the most common example is the Toffelmeier retainer that we use. Then based on the type of band, the matrices can be classified as metallic, non-transparent bands and non-metallic transparent bands. Depending on the type of cavity, we have matrices for different types of cavities like class 1 cavity, class 2 cavity. Class 1 cavity, the most commonly used is the double-banded Toffelmeier. Double-banded Toffelmeier is basically would be used for cavities which have a buccal extension. Then for class 2 cavity, we have the IBD number 1, number 8, the copper band, the anatomical matrix, and the auto matrix. For class 3 cavity preparation, we have the mylar strip and S-shaped matrix. For class 4 cavity preparation, we have the custom lingual matrix and the modified S-shaped matrix. For class 5 cavity preparation, we have the window matrix and the cervical matrix. Today we'll be discussing about the three most commonly used matrix systems, which are most commonly used in for the class 2 restorations or MOD restorations. So basically, the first retainer that we'll be discussing about is the Toffelmeier retainer. We all know Toffelmeier retainer was it was found by Dr. B.F. Toffelmeier. It is also known as universal matrix. It can be used in almost all types of cavity preparations. So this is how the Toffelmeier retainer looks. So basically what we do is the matrix band is fitted over the retainer and then the assembly is fitted loosely over the tooth. After which this entire assembly has to be tightened by means of the screw. So we'll be discussing about it. So this is the entire assembly which will be, this is the slot of the Toffelmeier which always has to face gingivally. The wooden wedge has to come from the lingual or the palatal aspect, okay? And this is how the entire assembly has to be, right? You can see how the matrix band is contouring or is properly adhering to the tooth structure so that there is no gap between the gingival margin and the tooth. We cannot see any gap. This is how the Toffelmeier retainer has to be placed. So basically, it is indicated for a class 1 cavity with buccal or lingual extension and for a class 2 cavity as well. Advantages being that it is easy to use, there is good contact and contour established, it is rigid and stable, but however, it does not produce a very good contact and contour, and it is not useful for extensive class 2 restorations. So basically, you can see how the entire assembly is the slot facing gingivally. The band has to encircle the tooth, the circumference of the tooth. We'll be discussing about the placement in detail. So these are the slots. This is the loop from the band can extend in straightwise direction towards the right, towards the left. All these directions it can extend. So let's first discuss the parts of a Toffelmeier retainer. There is a small knurled nut. There is a large knurled nut. This is the band. This is the matrix band. This is the head. This is the locking vise. And here there's a guide slot, which you can say. And this is the spindle, pointed spindle. So, as I told you before, the outer knob, the inner knob, the large knurled nut, or the smaller knurled nut. The outer knob, what is the purpose of the outer knob? The outer knob is basically the outer knob here, which I'm talking about, will basically be used to hold the matrix band securely within the retainer. The inner knob is used to increase or decrease the size of the matrix band loop when placing the band over the tooth. Okay. Then we have this diagonal slot. The diagonal slot will basically engage the matrix band. Okay. And as I told you before, the retainer is always positioned in the mouth with this slot, which is positioned towards the gingiva. Okay. Then we have the guide slots. Guide slots are used to position the matrix. Depending on whether it's a left quadrant or the right quadrant, we have to basically engage it on the left side or the right side. Like we had seen it before. This will be used either towards the left side or the right side. Okay. Let's discuss the steps in placement of a Toffelmire, and then I'll show you a video of the same. So so first what we have to do is we have to fold the band to form a loop. We have to take care that the open end of the retainer is always placed towards the gingiva. We have to position the matrix band in the retainer. Then what we do is we turn the small knob clockwise, which is basically used to lock the matrix band within the retainer. And then when we are positioning the matrix band on the tooth, we have to take care that the occlusal portion of the band has to extend 1.5 to 2 mm above the marginal ridge for above the marginal ridge of the adjacent tooth and the cavo surface margin to allow for proper condensation of the amalgam in the marginal ridge area. Okay. And the gingival portion of the band extends 0.5 mm below the gingival margins, cavo surface margin. And then we have to tighten the band, turn the larger knob, we have to tighten the band, which will basically decrease the diameter of the band and tighten it around the tooth. Tightening of the matrix is very much important, which will allow us to do a proper condensation and development of a proper contour. So let's see this video. So this we will be discussing the placement of a Toffelmire retainer on tooth number 46. So this is how we have to place it. The slot has to always come gingivally. These are the guide slots into which the band, the loop, we'll make a loop of the matrix band, and then we will either move it to the right and left side depending on the quadrant that we want to place it in. So the band will encircle the tooth circumferentially with the slot facing gingivally. And then we'll have to tighten the screws, the smaller one and then the larger one. Okay. After which we have to place a wedge. So the wedge has to be placed from the lingual aspect, and the base of the wedge will always face gingivally. So now you can make sure, see that there is no gap between the gingival margin and the tooth. So this is how the matrix band has to be placed, Toffelmire band has to be placed, right? Next, another important aspect for us is to know how to remove this Toffelmire retainer, because many times when we try to remove the Toffelmire retainer in an improper way, the restoration also comes along with it. So it's very important for us to discuss that as well. So the first step would always be to remove the wedge, and then we have to loosen the smaller and the larger nut, so that we will remove the retainer first, the Toffelmire retainer first. So after we remove the retainer, we have to basically remove the wedge from one end and then slide it from the other end. So this was about the Toffelmire retainer, how to place it and how to remove it. Next, we move on to the next commonly used retainer, which is the ivory number 1 retainer. So the ivory number 1 is adjustable metal. You can see these are the metal bands. Basically, they will be used for either an MO or a DO. Okay, so this, as you can see here, there is a projection in the band. This projection is always kept towards the gingival margin. Okay, so when we are placing the band, we have to make sure that this projection goes to the gingival margin, and these things, these projections on the retainer have to go interproximally, right? So this is how the band has to be placed. This projections on the retainer will be placed interproximally. The projection on the matrix band has to face gingivally, and we can very well make we can see here the close adaptation of the band to the cavity walls. So let's see this video again. This is about the ivory retainer. So again, we'll be placing the band on the tooth number 46. So this is the band. It has holes within it. We have to see, depending on the size of the tooth, we have to see how much, uh, which loop do we need to engage it in. So depending on the loop, we have to engage it within the projections. We engage the band within the retainer. And then the retainer always will be coming out of the mouth. And this will go interproximally. And then what we have to do is we have to tighten it. Okay, so now we can see that the band is placed. The next step would be to place a wedge. So this is how the ivory retainer would be placed, right? So next commonly used the band system is the sectional matrix and ring. So this is the band which I was talking about, and this is the ring. So this is how it has to be placed. Okay. So here this is a clinical picture of distal decay which was present in tooth number 14. Initially pre-wedging was done in order to create space. The band was placed, and then the entire system was placed. The sectional ring was placed. Okay. You can see how closely adapted the band is to the walls of the cavity. So let's just again see one more video of the same. So we are placing a sectional ring now. First, what we do is we place the band. And then we have to place the wedge. After which what we'll do is we'll use the forceps, and then we will place the ring. So we'll engage the forceps with the ring, within the ring, and then we'll place it on the tooth interproximally. Okay. This is how the sectional ring would be placed for a class 2 restoration. So moving on with the light, we'll just discuss about wedges. So wedges are nothing but small tapering triangular pieces of wood or clear plastic which are about half an inch in length. We have two types of wedges. We have the plastic ones, we have the wooden ones. Most preferably, we'll use a wooden one because wooden one, they tend to absorb the saliva and help in better isolation. So this is how the wedge has to be placed. As I told you, the base is always gingival aspect. And in case we are using this shown earlier as well, so the wedge basically will help in stabilization of the retainer and the matrix band. So the first band will be placed and here the retainer will be placed. So this is a picture which is showing how exactly the wedge has to be placed and not placed in this manner. So there are different functions of wedges. They help in rapid separation of teeth. They prevent the gingival overhangs of restoration. They even provide space for to compensate for the thickness of the matrix band. And as a result, they help in stabilization of the retainer and the matrix during the restorative procedure. They help in providing close adaptability in cervical portions of the proximal restoration and thus achieving correct contour and shape at the cervical area. Also, they can be used in retracting and depressing the interproximal gingival area, thus helping in minimizing trauma to the soft tissues. Also, they can be used in depressing the rubber dam in interproximal area. So there are different techniques of wedging. We'll just discuss it very briefly. There is the piggyback wedging, which is basically used in patients with gingival recession. So a wedge is placed at the apical margin and over that a second wedge is placed. So this is called as piggyback wedging. Then we have something called as double wedging. Double wedging in which the one wedge is placed from the facial embrasure and another wedge is placed from the lingual embrasure. So these double wedging is basically indicated when the proximal box is wider facio-lingually. And then we have the last most important technique. Other technique is wedge wedging. Wedge wedging is basically employed for the mesial aspect of maxillary first premolar because of the fluted roots, the concavity which is present in the roots. So first we'll place a normal wedge like the way we do, and then we place a second pointed wedge which is inserted between the first wedge and the band to wedge a matrix band tightly in this margin because this is the area where there will always be an opening. So what we have to do to reduce the opening, we have to place another wedge on top of it. Okay. So moving on with the conclusion, the matrices play a very indispensable role in creating proper contacts and contours. No matrix band is ideal. Almost all the proximal cavities need a matrix depending on the requirement of the specific case. These are my references. Thank you.